Low-grade DCIS. Had a question about the treatment of low-grade DCIS. In other videos that I've done here at Breast Cancer Answers, I've really emphasized high-grade DCIS, and particularly my concerns about high-grade DCIS as far as the propensity or the odds that high-grade will recur locally and other related factors. So we've had a question about low-grade DCIS. Now I want to remind everybody that fundamentally there are 3 grades of in situ breast cancer, just like there are 3 grades of invasive breast cancers: low, intermediate, and high. Or when we talk about invasive cancer, we talk about well-differentiated, moderately, or poorly differentiated. But let's stick to DCIS, ductal carcinoma in situ, and let's talk about low-grade DCIS. Well, a lot of debate actually about low-grade DCIS. There are certainly those who feel that low-grade DCIS can probably be treated with maybe a simple lumpectomy. There's another camp of people who feel that low-grade DCIS may not require any treatment at all. In other words, is low-grade DCIS similar to some of the low-grade tumors that we see in the prostates of men who over years and years and years do absolutely nothing? Well, I think to ultimately answer this question, what we've got to have is much more in the way of molecular information about these various grades of in situ breast cancer, and to then know what the natural history of that molecular information will be. Now, one of the advantages of the Oncotype DX test for DCIS is that at least we're beginning that process of starting to look at the molecular profile, if you will, of in situ breast cancer to help us predict whether a patient needs radiation therapy or not. And I would refer you to one of the prior videos that we've done on this here at Breast Cancer Answers. So what's the standard treatment of low-grade in situ breast cancer right now? Well, certainly, I think, and depending on the age of the patient and many other factors, taking that area out and having negative margins that I've talked about. In other words, a rim of normal tissue all the way around. Frankly, depending on other factors that a local multidisciplinary team can help you with, that may be all the treatment you need, and then close follow-up. I certainly have many patients with low-grade, small areas of DCIS that's the case for. Now, you can also have low-grade DCIS that may involve a very large area of the breast. And then getting all that out might lead to a significant cosmetic deformity of the breast. And frankly, if you're in that situation, believe it or not, maybe mastectomy is the way to go. So I can't generalize for obviously every case, because the size of the in situ matters, the location of the in situ matters, the size of the breast matters as far as the surgical approach, and then the issue of radiation therapy, again, size can matter, but I would also refer you to the video here at Breast Cancer Answers about using Oncotype DX with DCIS. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.